All right, good evening, everyone. Again, this is Jason from Honorary Spine and Joint. So thank you for joining tonight. Just a few kind of housekeeping items. At the bottom of the screen, you should see a chat feature and a Q&A feature. So if you have questions that come up during the presentation, please type those into the Q&A section. And those questions will be answered at the end of the presentation. So tonight, Dr. Bernstein will be joined by one of our physical therapists, Rachel Wright, to discuss quarantine fitness for back and joint pain. Just as a reminder, this presentation is for educational and informational purposes only. It may not be considered as medical advice. The information is not intended to replace medical advice attained during a medical evaluation by a qualified provider. If you would like specific medical advice regarding your specific situation, please feel free to call or text our office to set up an appointment. I'd like to just take a brief moment, highlight a couple recent changes here at MSJ. The first is our new 11,000 square foot physical therapy performance center, which opened last July, and it's located directly behind our main facility. The new clinic features state-of-the-art rehabilitation equipment, a walking track, turf field, and expanded space to be able to treat patients without being crowded into a small area. To schedule an appointment, you can call or text our main office or call the PT department directly at 831-264-6040. We're also really excited to announce that in the space where the PT clinic was previously located, we've officially opened MSJ Today, orthopedic-specific urgent care center. It's available for things like breaks, sprains, strains, and pain. The clinic accepts walk-in appointments on a first-come, first-served basis, and you can also be scheduled for a same-day or next-day appointment by texting or calling the office. You're also able to schedule an appointment yourself through our website. The clinic is open 7 days a week from 9 a.m. to 8 p.m. Monday through Friday and 10 a.m. to 7 p.m. on the weekends. So without further ado, I'm happy to now turn the presentation over to Dr. Bernstein and Rachel for tonight's series. Thank you.
All right, everyone. Nice to see you and meet you here tonight. I'm Dr. Jesse Bernstein. And tonight, we're going to be talking about some topics here. It's kind of a generalized topic we wanted to discuss, me and Rachel's kind of approach that we take to sort of fitness in general, and thinking in the context of the quarantine especially. This has been a hard time for a lot of people. And one of the ways it's been challenging is with gyms closed, people having a little bit more trouble exercising and, staying healthy and fit. And what we wanted to talk about here is kind of generally ways in which we approach exercise, both, kind of personally, and we kind of take a scientific approach to that in a lot of ways without even really thinking about it as, doctors in our fields. And we kind of wanted to share that approach to you and how you can apply that to not just work hard, but work smart when you're exercising, doing your activities at home with minimal equipment for all people, whether you're, a young athlete or, an older person or anywhere in between with disabilities, no matter your situation. So we're going to get into certain aspects of pain science, certain concepts that help to reduce your pain in general. And then when I like to think about exercise in general, I think of it as almost a balanced meal. So there should be elements of strength training, and we're going to get into various elements that I think are particularly key in terms of strength training. We're going to talk a little bit about flexibility and range of motion. I think this is particularly key for longevity. It's super critical. And as well as endurance training. And we're going to get into some of the concepts regarding endurance training and what that looks like and what that means to us. So like I said, I think that if you're going to, do any form of exercise, you should be hitting all those three key elements. 1, 2, 3, strength, flexibility, and endurance. It should be in every single one of your workouts to some extent. And how to balance that and how to go about that. We're going to get into some of those details as we go here. So in terms of just strength, generally speaking, some of the goals of that are when we're talking about pain and talking about how to reduce pain and talking about how to almost take a prehab approach to our workouts, a really important concept is that you want to develop balanced strength across a joint. Okay, so if you have this one person who is, can lift 80-pound bags of concrete without a problem, but then they have back or knee pain, why is that? And then, another person, like this lady in our picture, she's got no issues whatsoever. The key is balance strength. So each muscle group needs to be equally as strong to the antagonist or opposite muscle group. And that's a lot of times what helps to reduce pain across a joint. So developing balance strength. Also, it's really important to find areas that you're weak. Don't just do what you're good at. You got to find what you're weak and then work on it. And Rachel's going to get more into, identifying there's specific muscle patterns that we tend to see with our day-to-day that tend to get weak. If you think of one thing I want to mention that's very important is that we really in our day-to-day tend to go from standing to sitting to lying down. And there's a lot of movement patterns that our bodies are capable of, like sitting on the ground in a squatting position, that in our modern world we don't necessarily do. So these muscle groups tend to get very weak, and this tends to create, imbalanced strength, as I said, and it's really important to work on these things. And another critical element is, I also see certain people tend to just avoid strength training. I see that men tend to focus a little bit more on strength and endurance. Women maybe a little bit more on flexibility and endurance. And I think that everybody should be doing this, whether you're, an older person or, female or whatever, everybody should integrate some elements of strength training into their workouts. Now, with that, I'm going to let Rachel take over and discuss a little more about what we can do from an exercise perspective to work out and some key elements for strength training.
Hi, I'm Rachel Wright. I'm a doctor of physical therapy, and I want to give you guys first an overview of what physical therapy is. It's changed a lot through the years. So physical therapists hold advanced degrees. Many years ago, you could practice with a bachelor's degree. However, our scope of practice and knowledge has shifted, and our knowledge of medicine has grown tremendously over the years. That all schools now offer 3-year doctorate programs. It's a DPT. So physical therapists do have to pass a medical board exam to obtain their license and to treat patients. There's various settings that physical therapists do work in, such as hospitals, outpatient clinics, cardiopulmonary, neuro rehab, lymphedema, wound care, and post-operative. So one thing that might be interesting for people to know is that we also treat vertigo. So that's brief bouts of dizziness or dysfunction of the inner ear. In many states, in regards to direct access, you see the point there. In many states, you can be evaluated by a PT first without seeing a doctor. These states have direct access, which more states are leaning towards, but this type of practice. But the profession is so rapidly changing with an advanced degree that that's becoming more common. And then myths about PT is going to be, sometimes you hear people coming from a PT clinic and it's a no pain, no gain type deal. But really, the best thing you can do in physical therapy is not just push through pain, but rather learn your body and not overdo it, knowing that if you underdo it, you may not see the results you expect to get. So there is a good balance there with that being said. And then another myth is, okay, I'll go to physical therapy and get a nice massage. But it's not like the nice relaxing massage that you would expect. So it's the point of the things we do in physical therapy is going to be to decrease tone and tightness and to increase tissue mobility. And then another one is, I cannot cure your pain as your physical therapist. I can lead you through exercise, flexibility, and education, how to move differently and build strength and flexibility. But really at the end of the day, only you can help your pain because you really have to do those things in order to make those changes. All right, and so The first thing I'm gonna get into is the squats. So this is one of the best exercises I like to give my patients that I see. It's a very functional exercise. There's two different types I like to differentiate. So the first bullet point is quad dominant squat versus glute dominant squat. And so that first image up top, you can kind of see where the one on the left there, where she's bringing the knees forward over her toes a little bit. That's going to be more quad dominant. There's a myth too that that's a bad squat form and it's going to hurt the front of your knees. It may give a little more pressure on the patellofemoral joint, but it won't necessarily hurt your knees. It's just a different form of squat, and when doing it properly, it can build strength specifically in the quadriceps. And then the strength exercise on the right, where she's sticking her butt back a little bit, more like sitting in a low chair, that is going to be a glute specific squat. Either are correct, it's just depends on what the effect you're trying to get is. The front squat versus back squat. So that's going to be the lower image you can see there, the gentleman holding the weight in front, or the barbell or the dumbbell in front, versus on his back. And so the difference is here, I like to show people how to do a front squat, particularly when they have shoulder problems. So if they have frontal shoulder pain, then I'll show them how to do it with the weight held in front of them. Though when we think of weightlifting and squatting, we always think of the weight on the back, kind of a back squat. Technique is also very important no matter what type you're doing. I generally have your feet about hip width apart, maybe a little bit wider. I also recommend your toes coming out a little bit. When you do go to squat down and bend into it, I recommend kind of opening your knees up a little bit. You don't want your knees collapsing in toward one another. Another thing that's helpful is thinking about breath with this particular movement. So I always tell people to breathe out when lowering. This is helpful for people with high blood pressure, not to create a Valsalva maneuver moment, which is when you're holding your breath and really straining tight. You want to breathe out as you're lowering down. Lastly, again, for more shoulder and neck protection, I recommend that you squeeze those shoulders back no matter what weight you're holding, even if you're holding no weight. And that will give you better form to engage your core as you lower down. And lastly, intensity and repetitions. So this is probably one of the most important bullet points beyond form, because a lot of people, when we do exercise, we underload ourselves, and that is the problem with, sometimes people go to physical therapy and they're like, I don't know, nothing happened. But it's really important that when you're done with a session that maybe you feel a little bit sore in certain groups, you want to feel that soreness. It means you're building muscle. So when you have the proper intensity, you may be feeling muscle soreness the next day. In regards to intensity, if you're doing higher repetitions, generally I don't recommend you grab the heaviest weight. Otherwise, if you are doing a heavier weight, you can work up to higher repetitions, but that would take time. And when you get to repetitions, I recommend that you do ones that you basically go until you feel fatigued in those muscles that we had talked about earlier. The glutes or the quadriceps with that particular exercise. So repetitions are important. There's not a magic number. So you want to go and you want to do a couple sets. So maybe you're doing one set of 10, one set of 8, one set of 6. And that's a good 3 sets that you're doing of squats that you're really pushing yourself, hopefully. And that's why you're doing a little bit less with each set.
Well, one question I had actually before we move on to the next section is, let's say I have a lot of patients who have trouble, even getting up from a chair. So now, as we are seeing here, it's super important to work on glute and quad strength with squats. But what if you can't really get down? What kind of recommendations do you make to make adaptations to that with people with pain or joint issues?
That's a good question. So when I think of people who haven't moved a lot in a while and they're in a lot of low back pain and they've been laying in bed, which is the worst thing you can do with low back pain. You really want to get moving. I just recommend that you sit in a higher chair and you practice sit to stands. So you'd be crossing your arms, kind of feet hip width apart, leaning your body weight forward to go and stand up. And you can use your hands at first if you need to, or you can make the chair a little bit higher to make it easier. And I would just work on this. And you can even do that to an endurance point, like time yourself. How many sit to stands can I do within a minute? Or how many sit to stands can I do in 2 minutes? And kind of progress yourself that way.
Great, so using a chair as adaptive equipment, love it.
And the next one I want to speak about is rows. So there's 3 different parts to this, and I like to show people how to do a scapular retraction to begin with before getting into the full motion. So this will help a lot with what I was talking about earlier with the squat, squeezing your shoulders back. That's all you're doing with this first bullet point. Scapular retraction is squeezing your shoulders back in together. And this is really a good exercise to do, even just to develop postural muscle endurance, not just strength. But the first thing you do is you just squeeze your shoulders back. And I have people do that, hold it for about a minute or so, and then relax. And so that's the first part of this exercise I like to show people. The next one is external rotation. And the reason I like to show this one is because even as we have shoulder problems and things like that, there's very specific muscles in the shoulder that help give stability and are basically underused, which is why I included external rotation. So that photo is of the man holding the TheraBand, which is that red stretchy band, and he's squeezing his shoulders back, which is step 1. And then step 2, he's slowly bringing the band apart into an external rotation position, and then slowly coming back in. And so that's going to be part of the rotator cuff that you could practice engaging if you have stretchy bands or things like that laying around the house. There's stores too that sell them. You can pick up a stretchy band to work on this muscle group. And then the last thing is the row form. And again, the reason I kind of included this row is to emphasize muscles of the shoulders that help you protect your neck and your shoulder and actually your upper back as you get stronger. So people with neck pain, this is kind of helpful for. So think about when you go to do a row, that's the bottom photo. You're going to be squeezing your shoulder blades back, pulling the elbows back in together, making sure they're not far away from your body. So elbows squeezed in. And a big mistake that I see people make is that the elbows, they bring it way back and way beyond their torso. And so it really puts a lot of stress on the front of the shoulder. So with the row, you really want to bring it to just about neutral position to where your shoulder, your arm is kind of in line with your rib cage. Okay. So don't bring your elbows too far back when you do a row. And then you really want to squeeze your shoulders back together at the end range and then slowly recover all the way to full range. And lastly, I want to show you guys the calf raise. Seems simple, but there's a few progressions on this one. So the first one is going to be that top photo on the top left with both legs flat on the floor. And you're just slowly coming up onto your toes, keeping your knees nice and straight. That's really important. People like to bend their knees with this one. So what I like to teach people is squeeze your knees tight. So you want to engage your quadriceps, that frontal thigh muscle group. So you're engaging your quads and you're slowly lifting up onto your toes, slowly lowering down, squeezing the quads the whole time. Okay. So the progression of that would be a single leg version. So you can hold on to a countertop or a very stable chair where you're slowly coming up and slowly coming back flat onto the floor. And that photo is the top right photo of the lady holding onto the chair. That's a single leg heel raise. And then the very bottom photo is the gentleman. You can see he's on a step. And so you're going to come all the way up onto your toes on a single leg. And then you're going to go all the way down almost to the point where your heel's just hanging off the step, almost like a calf stretch. And then from there, you're going to come all the way up onto your toes, slowly down, letting the heel hang down. And so that's a really challenging one If you're new to this, obviously I recommend that you start with 2 legs on a flat surface, holding on to something for safety. And you can kind of go until you get a nice light burn in the calves and relax, take a minute break, do another set, relax, take another break, and then do a 3rd set. So you should feel a little bit sore the next day, maybe. You may even cramp a little bit. So it's good to stretch those calves after this type of exercise. And the next thing I want to talk about is strength and power. And so strength and power. So the difference is if you were to do this calf raise nice and slow on the way up and slow on the way down, that is for strengthening. It's just normal muscle strengthening. If you were to develop more of a power to it, then the difference is velocity. So you would come up on your toes rapidly and slow on the way down. So that would create more of a power exercise. So up really quickly onto your toes and then slowly lowering down versus slow on the way up and slow on the way down is just strength. Power is very important. There have been many studies done that show that helps reduce fall risk in many older adults. So if this sounds like you, I think it would be a really good thing for you to start with a double leg heel raise potentially and see if you can work up to going a little bit quicker with your repetitions and work on that calf strength and then the power. This is one of the secret ingredients to strong knees. If your quads and hamstrings are looking and feeling good, but you're not sure why you have knee pain, this may be what you're missing. So don't discount the calf muscle. It's very important for fall prevention and also any kind of knee pain or foot pain that you may be having. In terms of intensity, like I said earlier, you're going to want to go light for the first few times you try this exercise, but in terms of intensity, you want it to feel like a moderate intensity, maybe feeling a little sore the next day. Repetitions, you could do 3 sets of 10 to start out with. And then if you want more of an endurance exercise, if you're an endurance runner, you could go for much higher reps than that, work up to 20, 25 repetitions. If you want to bump up the intensity, if you're safe and you're holding onto a surface, you can also hold a dumbbell in the other hand and increase just the weight with this one.
All right, so I love all that. So I know from my perspective as well as a doctor, when I see patients all the time in strength training, those are definitely key muscle groups to work out. So things working for people with neck pain, doing some of the scapular traction type stuff to strengthen upper back, glute strengthening for low back, and then calf strengthening for knees, hips, and low back, the whole deal. Everything kind of works together, and I see that as well. But those are key muscle groups that tend to be weak in a lot of patients that create that unbalanced strength that leads to pain. So now I'm going to get a little bit more into as well, flexibility and range of motion. Motion is the lotion. You got to keep these joints moving. And an important concept that I want to talk about first and foremost is there's different types. As we're focusing on those muscle groups in the biceps contracting, the triceps is going to eccentrically stretch into that area, okay? So it's basically the antagonistic muscle group is stretching slowly, and this is a controlled process that's actually happening between the spinal cord to slowly elongate that muscle. And if you do that in a proper fashion, to isolate the muscle in an eccentric fashion, that can be a really therapeutic way of helping with tendon-related issues. And dynamic stretching is the next thing, when you're moving into different muscle groups with mobility. So this might be something that Rachel was talking about. If you're doing really low weight or body reps with some of those other strengthening exercises, just focusing on form and mobility. So if you're doing a squat to work on hip flexibility, if you do that completely unweighted, but you're just focusing on your mobility into your hip joint with flexibility, that can be really critical. I know very commonly, I see a lot of people whose body position is almost stuck, like they're sitting in a chair. Like their flexibility is barely past 90 at their hips. And, you know, it's basically like their hips don't extend and they barely flex past 90. Our bodies have basically adapted to sitting in a chair. And so if you go up, as soon as you stand up and you have back pain, no wonder your body has just kind of contorted itself around a chair and you haven't been, moving and working on your flexibility. So those key elements that I see to try and reduce back pain, if you're going to do nothing else, if you want to be as efficient as possible, like we said with strengthening, I want to see you working on hip flexibility, hamstring flexibility, calf and lower flexibility, and working on your spine flexibility in the 6 planes of motion. So what that means is flexion, extension, lateral rotation, and twisting in both directions. So if you're going to do some form of stretching, and I recommend that you be doing a little bit of stretching every day in your routine. I know I personally wake up every morning and do like 20 minutes of stretching. My mom was a yoga teacher growing up, so I, started doing this stuff as actually a little kid. And as I got older and more injuries, I started taking to it more and more and doing more and more yoga and got really into it at various stages of my life, which some of my patients probably already know about. So I can't speak highly enough about it. And as it goes, I think it's really critical. If you don't have that mobility, then you don't have the strength. I mean, just think about it. If your biceps can only go from here to here, then you're not going to have that, the proper strength into your arm. You're not going to be able to do anything. And let me tell you something. If you just move your arm from here to here for 10 years, guess what? Your flexibility is only going to be this, okay? But since this is a more normal movement pattern for us, we can move our arms easily from flexion to extension. But that's basically what happens in other joints, in like our hips, for example. If we're just going from sit to stand, then we're not having that flexibility and extension. We're not having that flexibility, outward, like we're sitting on the ground, which our bodies are, have the potential to do, but we're not necessarily using it to our full potential. So that's why we got to think of exercise as balancing our normal life movements to kind of, create that pattern, which helps to reduce pain and improves joint health. So I just want to talk about this really briefly, this concept of, why stretching is so good for helping your muscles. And so what I want to focus in on here is the Golgi tendon. If you see that at the bottom portion of the screen. So the Golgi tendon sits in the musculotendinous junction, or the area around where the muscle and the tendon meet. Now what happens is we stretch. That tendon, the little fibers in there start to pull, okay? So that tendon, there's a little receptor in there that senses the tension within the muscle, okay? And so a big part of, and what it does is when it senses stretching, it sends a signal to the spinal cord and it goes straight back into the muscle. It doesn't go up to the brain, it just goes straight back into the muscle that says, hey, muscle, contract. Don't go any further. You're gonna get hurt if you go any further. So that's what says how far we can stretch. And really, the reason I want to mention that is because the biggest part of our stretching routine is going to be pushing back beyond what the Golgi tendon is telling it to do, to work on that flexibility so that it doesn't fire as much or as frequently. And a lot of times people suffer from muscle spasms, you have contractures, issues such along those lines. And that's why stretching is so important to help with that, because it's overriding the Golgi tendon, either using those eccentric stretches to trick it into relaxing, or using these stretches to just have that signal going so frequently that those receptors get deconditioned and stop firing so the muscle can start to actually relax and we start to feel better. So that's why it's so critical, and that's just all I'm going to say about that, because that's a whole topic unto itself. Now again, a lot of words on this page, a lot of different muscles to look at. Generally speaking, I just wanted you all to get a picture of what the paraspinal muscles, so the muscles that keep us upright. So when I say, hey, my friend, you got to go work on core strengthening, I want you to just have a visual in your brain of this is what I'm talking about. These are the paraspinal muscles. There's a lot of them, and they do a lot of different things. You know, as I said, all those positions of flexing, twisting, bending, every single different coordinated muscle group does that. So I just want you to think about all these muscles when I say core strengthening that need to be stretched. So this is generally called the paraspinal or erector spinae. And the other key muscle groups that we're going to get into here are the iliopsoas, the abductors and adductors, your hamstrings, your quads, your obliques, and your abdominals. All of them you should work on stretching. And I just want to help you. I'm going to show you some pictures of some of these muscle groups because at least personally, I'm a very visual person. So I think if you can visualize them, you'll kind of know what you need to work on and then take it from there. So one of the key muscle groups that we have here at the spine to the left there is the iliopsoas. So the iliacus and the psoas muscle combine, and that is one of your key hip flexor muscles. That is a very strong, powerful muscle. And what I notice all the time with patients is that muscle gets shortened. People are sitting all day, and then when they go to stand up, that muscle is too short to even go past like a flat neutral position. And a lot of times patients, they end up sleeping in recliners or this or that, and that's because that muscle has been so shortened over time that they can't even lie flat anymore. So I think it's really critical to work on your hip flexibility, both inward to get that muscle contracting up to its fullest potential, and then expanding and stretching that muscle with hip extension. As well, to the right, a lot of people have heard of piriformis syndrome. To the other screen, we have a lot of the gluteal muscles, and Rachel talked about how to strengthen those, but stretching those is also super important. To work on the flexibility into those hips is absolutely critical. Again, just think of your biceps. If it only goes from here to here, you're not going to have any strength into that. You got to work on that full range. So working on hip flexibility is another key that I see people are lacking all the time. We're not sitting on the ground Indian style these days like we used to, maybe back when we were cave people. And so working more dynamically and naturally into that, super critical to reducing pain. And again, just key muscle groups. This is more for, like, again, the muscles that cross the knee joints, and these joints are really important. So working on hamstrings and quads, working on flexibility into those areas. And what I really like and encourage patients to do is not just do these stretches in a box. It's good to have a couple ones to work on, but I really encourage people to A, have fun with it, and B, to explore different types of things which work on more dynamic mobility. So whether that's Tai Chi, yoga, Pilates, aquatherapy, dancing, whatever it is you're into, I just want you to start thinking about incorporating these things into your workouts. So it drives me crazy when people say, yeah, I work out all the time, I go for walks. And I'm thinking in my head, that's just what you do to get from point A to point B. That's not really exercise as far as I'm concerned. You got to be having it be more dynamic. Every day we sit, we stand, we walk. So thinking about ways to integrate these different muscle groups, to have it be more dynamic, to work these groups that you aren't usually, to working on better range of motion into these joints. If you walk, then you should be doing some stretching before and after. If you do yoga, you should do some strength training. If you're doing Tai Chi, again, some strength training and endurance. Again, it needs to be a balanced meal, and if you're doing any one of them, then it's not enough. Dancing is great, it involves a lot of things, but then if you have really bad joint pain, that can be a real challenge. So this in our picture is BKS Iyengar, and he's one of the famous yogis that brought yoga from India and helped to popularize it in America, or more westernized countries, we might say. And so I think it's really critical to take these concepts and integrate it into our workouts to have it be more dynamic. The next piece we're going to move into now is endurance, and I'm going to let Rachel take over again in a minute. And the last one, just one thing I want to mention about endurance. I spoke about walking. Okay, a lot of people walk for exercise. How I want people to think about endurance is one, in terms of just muscle groups being able to tolerate a posture or a movement for a long period of time, which Rachel is going to get more into in a second. But also think about your VO2 max, okay? So here, I'm going to break this down real quick for you. So your VO2 max is 220 minus your age in terms of your heart rate, okay? So if you, again, quick reminder on how to take your heart rate. You can either, a lot of people have those Fitbits, but you can do it the old fashioned way. Just, put your hand to your pulse there and count either 15 seconds or, 30 seconds with the watch. And then either if it's 15 seconds, then you should times it by 4. If it's 30 seconds, times it by 2 or count out a full minute. And that is your, heart rate beats per minute. Okay. So that's what we're talking about, beats per minute. So your VO2 max is 220 minus your age in terms of beats per minute. So in order to achieve optimal endurance, you should be striving towards 10 minutes at 70% of VO2 max. Okay, I don't know how all you were good at math, but I'm going to break this down. Okay, so let's say you're 60. I have a formula up here. So if you're 220 minus 60 times 0.7 is going to be about 112 beats per minute. So if you think about it, that might be what you hit if you're, walking up a hill down in Monterey. Okay, you're not just walking on a flat surface, but either doing a light bike ride or something where you're starting to feel your heart rate rise to a reasonable level, but you're not, you're maybe not getting all the way up to your full heart rate, but you're kind of in that 70% zone of of roughly where you'd be. And you want to hold that for about 10 minutes. Now, even if you have joint pain, you can find ways to make this happen. Whether it's doing things in a chair, I always recommend chair yoga or aqua therapy or, all different types of things. It's a matter about getting creative and think about trying to achieve this. When you're saying, okay, I'm exercising, if you're walking, think about it. Am I achieving this VO2 max of 70% for 10 minutes? And if the answer is yes, then okay, cool. You're hitting your key elements of endurance. And if not, maybe you need to be turning up the intensity and maybe you're not really exercising into that. And it's just, it's not what it could be. Okay. And so I'm going to hand it over to Rachel again to talk a little bit more about posture and ergonomics.
Thank you. Yeah, to Jesse's point, it's been really fun watching people push themselves and being able to achieve better endurance while working with them. So if you feel like you're challenging yourself and you're, get your heart rate up within 70% of that heart rate max, I think that would be a great thing, a great goal for you to try and hit at least once a day for 10 minutes. Thank you for including that. So in terms of muscular endurance, I'll be speaking about posture and ergonomics. Which, a lot of us now, we sit all the time. If you think about back in time, the cavemen, they weren't sitting at a desk like we have to now. And so a lot of the patients I see with low back pain have a pretty sedentary job. And so I do recommend that those types of patients consider finding a standing desk. However, if you don't have that capability, and, with quarantine especially, you find yourself sitting at a desk for long period of time, the ergonomic setup is going to be very important. So as you see in the photo, the top 1/3 of your computer screen should be even with your eyesight so that you're not craning your neck up or getting headaches that way. Your upper back you want supported. You don't want to sit on a stool or something like that. In terms of your lower back, to support your lumbar curve, you could put a pillow back there, fold it in half, and it will help create a little bit more of a lordotic curve is what it's called. And it makes it so that you arch your back a little bit more when you sit, which really does help a lot of people with back pain, is just changing the way you sit. You get to the wrist and it's showing just a neutral wrist setup. I'll show you my wrist. So if you're typing like this or with your hand extended like this, you're going to be at risk for carpal tunnel issues. You want it to be flat, just like this when you're typing. And then you want to sit on your sit bones. So those are kind of when you arch your back and almost like you're sticking your butt out when you're sitting. That makes you sit on your sit bones more, so that you're not sitting on what's called your sacrum. So when we slouch, we sit on our sacrum. But when we sit up, you're sitting more on your femurs or your legs and your sits bones. And that takes a lot of stress off of your back. And then it shows thigh behind the knee. So this is especially for taller people. You know, if you're really, really tall, sometimes your knees are up really high. You want them to be flat against the chair. If not, if actually your hips being a little higher than your knees when you're in a chair. So if you can change the chair height to a point where your hips are slightly higher than your knees, that's actually what I want. And you don't want a lot of space between your lower legs and the back of your knees when you're sitting on a chair. So you don't want to be sitting too much on the edge. You want your full legs supported by the chair, feet flat on the floor, and then making sure that above all else, you're trying to engage your lower tummy muscles as you're sitting. And then on the image to the right, it's just showing good posture ergonomics. So I might be showing someone how to do a sit to stand or a squat, and they have perfect form with all of it. And then they go to set the weight down and they're just torquing through their back, just tossing it down. So what I really do tell people when we're learning squats is good form when you're doing the squat, but also good form with setting the weight down. Or, you know, if you're lifting something heavy for gardening or a small child, you want to make sure you're squeezing the shoulders back, keeping the weight as close to your center of mass when you go to set it down. The further out the weight is from your body, the greater the lever, and it could torque your back or your shoulder or your neck as well. And then posture exercises. So these are very specific little muscle groups, very minute. A lot of people do forget about them or don't even know about them. The first one is going to be scapular retraction, which if you look to the top right corner we've already talked about it. So maybe you guys are old pros at it at this point. It just is squeezing the shoulders back and together, maybe holding for a period of time, like a minute, 30 seconds before relaxing down. If you're anywhere and you have low back pain or neck pain, this could be an exercise that you try to initiate. Or if you find yourself slouching, you just squeeze your shoulders back. It's really hard to slouch and squeeze your shoulders back. So trying to sit tall and bringing them back in together is going to be a good habit or exercise that you try to implement into your daily life. So maybe you get up in the morning, you do it, or you're at a stoplight and you squeeze the shoulders back in together. So that is scapular retraction. And then the second one is the transverse abdominis. This is on the left, the photo on the left. The person is laying on their back. And basically what you're doing is you're pulling your lower belly button in, this lower belly button muscle. So your transverse abdominis is not your rectus abdominis. That is your six-pack abs, right? We all know how to kind of engage those muscles. So the transverse abdominis is a little more elusive. So if you find your hip bones, if you were to put your hands on your hips, right, and then come in toward your belly button just a little bit to find that muscle group, and then think about tightening that lower core by pulling your belly button in toward your spine. Maybe you've found it, maybe you haven't, but the biggest thing here when you're trying to engage that lower core is that you're still breathing. It's really easy to hold your breath with this one. So take a nice deep breath in and then slowly exhale. And this is a lower core muscle that a lot of people are not used to engaging. So this is especially if you have maybe you have a lot of weight in the front, or if you've ever been pregnant before, or if you are pregnant, then this is going to be a muscle group that has been stretched out and probably underused. So this is a good thing to try and engage that muscle wraps around to the back and almost has the effect of a corset. So when it engages well, it gives you support with things like squatting or getting up from a low chair, or even just walking a long distance. And I want you to notice when you are walking, if you have low back pain with that, if you start to slouch a little bit throughout the end of your walk. So these kinds of things, and maybe you try these tricks. You squeeze your shoulders back or pull your belly button in. The third muscle group here is the multifidus, which is just a fancy scientific word for your deep lumbar spinal stabilizers, which means that you have a little core in your back as well as core in your front, your abdominals. And so to engage the multifidus muscle, the easiest way I teach this one is if you were to sit tall, kind of like what we were talking about in the previous slide, feet flat on the floor. You can try this with me. And then imagine a string pulling you taller. Okay, like almost like you're a puppet, like a string's pulling you taller. That's going to naturally engage that multifidus muscle group. Okay, so think about all your vertebrae stacked up, and when you're slouching, they're kind of short, right? And then when you engage properly and you sit up nice and tall, you've got nice, good, strong spine where it's not in a adverse position. You want to try to engage the back muscles as well as the core muscles. So that is the multifidus muscle group. And then the last one there is the pelvic floor muscles. Some of you may be familiar with this one, especially if you've gone through pregnancy. It's called the Kegel or the pelvic muscle group contraction. And this is a more challenging muscle group to know if you're getting it right. It can help men and women. And it also can help you if you're making frequent trips to the bathroom. Again, if you do have this problem though, you should probably see a physical therapist who specializes in pelvic health. Okay, so a Kegel, you're gonna sit nice and tall for me, and you're gonna squeeze the bathroom muscles, almost as if like when you're urinating, you're gonna cut off the flow of urine. So this is the muscle group you're engaging when you engage the Kegel, okay? It's almost like your private muscles, okay? And when you engage that muscle group, you're gonna try and hold for a few seconds, making sure you're not holding your breath at the same time, okay? And then relaxing. It's really hard if you can tell that you're doing that one well or not. I encourage people to try when they're laying on their back, when they're sitting up, when they're standing, just different positions, trying to engage those very specific muscles. But basically, you want to think of that muscle group. If you look at the photo, imagine a hammock that's very stretched out, right? You want a hammock that's a little more taut. And so that one's going to give you more support from below so that when you're lifting heavier weights, you don't feel unstable in your lower back. So to bring it all together, it's almost like you're making a can, right? So with the top of the can being scapular retraction, the front of the can being your abdominals, back of the can being that multifidus muscle group, and the bottom of the can being those pelvic floor muscles. So it's a lot of coordination and it takes a lot of practice to get, but these are all things that you could think about in sitting, when you're waiting in line at the grocery store, when you're going on a walk, when you're running. So these are endurance muscles. It's not supposed to be a strengthening exercise. We already went over some of those muscle groups. These muscle groups are more endurance. It takes a lot of time to build them up, to even activate them sometimes. And it's challenging to activate, but once you've got it, it does help a lot of people with low back pain. So in summary, biggest thing we wanted you to get out of our presentation is that basically we want to give you balance, and there's 3 portions to this balance. First, the strength. So we want you to load yourself properly. We want you to, what we mean by that is if you're just doing light weights right now, maybe you could progress to a little bit heavier. If you're not ready for it, obviously ask a healthcare professional. If you're not sure, you can come to physical therapy or ask your current physical therapist, things like that. But basically, most of the population underloads themselves, and it gets people very weak and it makes people disabled. So I've gotten people back to doing activities that they love just by getting them stronger in a lot of ways. And I want you to feel motivated that you can do it no matter what your strength level is now. Like if you want to start with the sit to stands and work on that for a while and then get strong, once you feel a bit stronger with that, maybe you pick up a 5-pound weight and you practice your sit to stands with the 5-pound weight. Or maybe the progression is you're trying to sit in a lower chair when you do it. Okay, so that's strength wise. You want it to be challenging for you and you want to feel like your muscles are a little sore the next day. Not too sore. I want you still walking safely and doing the activities you love, but it does take quite a bit of effort to load yourself properly to actually get better and feel like you can move how you want to move. Flexibility. So you made a really good point that it's important that you go all the way through your range of motion and then some. So if you have a very shortened range of motion, you're going to want to make sure that you go all the way to the end, that you hold your stretches long enough, that you feel like you're stretching consistently. Because the only way to gain flexibility is not one stretch a week for 20 seconds. It's getting up. Maybe you set a routine like he has. He gets up every morning and stretches for 20 minutes. Doing that consistently, finding stretches that work well for you will help you move better and live just a healthier, more flexible life, feeling less stiff and more confident with some of even the strength exercises. And then lastly, endurance. So there are good points made today that most people do not load themselves properly for endurance either. You know, maybe the most you can walk right now, most you can do is walk right now. Maybe that's you. Okay. So one thing you could try to load more is put ankle weights on, or as he suggested, you could walk up hills and start with that. But the point is to try and get your heart rate up for a period of time. So if you have a job like where you're on your feet a lot, like mine, that doesn't really count as endurance exercise. So understanding that is the first step. Endurance exercise is where you get your heart rate up for a period of time, whether that's cycling, like a bicycle, swimming is excellent on the body, walking, rowing. As long as you speak to your primary care physician first to make sure it's safe for you. But you want to get your heart rate up in order to get it stronger. And then lastly, posture and ergonomics. So we learned a little bit about lifting with the squat, but also applying that to how you're bending and lifting around the house. So maybe you performed all the squats great in physical therapy or at the gym, but then you go and it's time to take the kitty litter out and you grab the bag and you're grabbing it with terrible mechanics. You want to make sure that you apply what you learned maybe here in this presentation or your lifting techniques in the gym, and you apply that to everyday lifting and bending, because that's how people hurt their backs. And that's a good way to prevent it is understanding lifting mechanics. And then lastly, posture. So thinking about those posture muscles, maybe you try to implement a few of them at work or as you're sitting listening to this presentation now, and you just basically apply it throughout your day. You don't have to do it once a day at 8 a.m. every single day. You could do it, when you remember it. Maybe you're at a stoplight, or maybe you're doing laundry or waiting for the microwave to beep off and you want to practice squeezing your shoulder blades back. So that's a summary of our approach to fitness for low back pain and joint pain.
Thank you for that great summary. I love it. I always take that approach too. And the thing that I love about that is that no matter where you're at, whether you're an elite Olympic athlete to, someone who's been having a ton of back and joint pain, and can barely go from a sit to a stand, if you integrate these concepts into your workout, it kind of creates a very balanced workout for absolutely everybody, with just making adaptations to figure out wherever you're at to get better and stronger. So I love that. So with that, we are finished, and we're going to move over into see if people have any questions on the Q&A, and we'll answer those. So we will start at the top here. So Jenny Watkins said, She'd broken her foot 3 weeks ago. Oh, well, thank you. Not really a question, but thank you. We do not have any closed captions at this time, but we'll make sure for the future. And I apologize, we had lost sound there momentarily. So yeah, so I love this question about getting the heart rate up if you can't walk or bike. That is a great question, and I think it's a really important one. My recommendations, like I said, just work from a chair. Start wherever you're at and work from there. You know, if you find yourself, just going from, a sit to stand, like Rachel said, or doing twisting exercises, doing bending exercises, everything really could be done from a chair. Find yourself as you're doing these twisting movements or upper body or core exercises, working out Kegels. And notice yourself, if you really become deconditioned and haven't been moving at all, you'll probably find yourself that you might be achieving your VO2 max even with those type of movements. So just start from wherever you're at and start pushing it from there little by little. Focus on those key muscle groups. I mean, you can just be sitting, doing those, calf raises. You can be doing, little movements to try and work on your glutes, doing straight leg raises. So that's where I recommend finding wherever you're at and kind of picking up from there. Did you have any other suggestions?
Yeah, so to get your heart rate up, understanding what getting your heart rate up is you mentioned earlier finding it here, like is probably the easiest way, or at your wrist here. You want to go on the thumb side. That's how you find your heart rate, okay? Thumb side, right by your wrist. But what I like to give people who can't walk fast or bike, the pool is really great for that. It's really great. Walking in a pool or swimming if you can. If that's not available to you, especially with COVID, if you're able to stand and do some standing marches, I'll demonstrate just so you understand what I'm talking about. So you're standing up here and you're just lifting your hips up like this, almost like you're marching. You can get your arms into it as well. But that's a really kind of easy win, especially when you get your arms into it. If you have like light weights, that's really easy to get your heart rate up that way. I'd say if there's a reason why you can't fast walk or bike, to go see someone for that, because those are two really nice and easy activities that I think would be helpful for you to be able to do. But the first good step might be marching in place, or as he was saying, little mini squats would be good, or sit to stands. So you time yourself. Okay, how many sit to stands can I do in 1 minute? Or, I'm gonna try and sit to stand for 2 minutes straight, and then just go from there.
Okay. The next question we have here is about hip flexors and what are some good exercises to work those out. So exercises that I like to do to work out hip flexors are basically going to be things that are going to work on extension and flexion. So in terms of flexion, just drawing your knees up into your chest. You can be lying on your back or any number of things, and working on drawing your knees up to your chest. And when you do it, focus on not just drawing your knee into your chest passively, but actively engaging that muscle as you do so. And that'll help to work on both strength and range of motion. Addition, now depending on your level of flexibility, this is going to vary for everyone, but you can do anything from plank, where you're lying down, a reverse plank, to work on flexibility into that area, or lying on your stomach and doing almost like a Superman type of thing to extend. Or in yoga, you're going to be doing kind of like up dog or cobra posture, where that's helping to stretch out that iliopsoas muscle. Another good posture from yoga is to do what they call a camel's pose, and there's a bunch of different modifications from that, where you basically go backwards and try and touch your heels. Now that gets into more advanced postures, so that might be for someone who's a little bit younger and more fit, a little bit more challenging in that concept, but working all the way from maybe planks to on your stomach to cobra to up dog to the camel pose. So every different progression to meet you wherever you're at. Do you have any more recommendations there?
Yeah, so hip flexors, a lot of times when I see people with hip flexor issues, I actually like to work them out through strengthening as well. So something like a lunge would be a very good thing for that. Like a lunge with hands overhead is going to be helpful for hip flexor tightness. And in addition to lunge being a strengthening exercise to help with flexibility issues. So it's kind of a double whammy, that particular exercise. Another thing I like to give for hip flexor just issues in general is like a kneeling position, which if you have knee issues, I always put like a big pad under the knee that's down. But if you kind of kneel in a tall kneeling position with one foot in front and one foot backward, and almost like tighten your tummy and tuck your butt under, then you should be able to feel it in the leg that's behind you. It's kind of hard to describe over this setup, but there are some good things that you can find sometimes even through YouTube of hip flexor stretches to give you a little more idea of what I'm talking about.
I see a couple questions here about whether or not you need a doctor referrals to go to physical therapy. Most of the time the answer is going to be yes, but it depends on where you're at and the type of insurance that you have. I'd say best bet is to probably check with your insurance carrier, and they'll probably be able to tell you what you need to go about that. It can be either from myself as a physician or your primary treating physician or whatever. Again, that is a variable question, and it kind of goes from state to state, place to place, insurance to insurance, so there's not one answer to that. Check with your insurance carrier wherever you're at for that answer. Another question here about using a ball instead of a chair. Of course, just start integrating wherever you're at. Just start bumping up the intensity as you go. And so, yeah, I think, right, that's, of course, fine. Just start moving it up as much as you can.
I love it when people use a ball for a chair. I recommend it to a lot of people. The hardest part about that one is making sure it's tall enough for your desk or a proper height that way. You still want your feet flat. You still want to sit nice and tall. If you do that, it's going to be very important that you consider the muscles I talked about today, trying to engage the lower tummy muscles in, squeezing the shoulders back, because it can also be easy to slouch on a ball, but overall that's going to give you a very great opportunity to engage your core muscles.
So we have another question here about someone who had a foot drop and has trouble with some of the exercises that we showed. And so in general, my approach is to, again, go back to what you can do and maybe use help with other muscle groups or resistance bands to start to work those muscle groups in a fashion that you can. So if you have trouble standing up, maybe use something hanging or something like that to help pull you up. So you're using, or use something seated to help push you up. Or if you have trouble with, doing extension with calves or something like that, just first work on just pointing your toe, writing the alphabet out with your foot, using a resistance band. So again, there's a lot of different workarounds. If you just think about the muscle group that you need to work on, there's a lot of different ways that you can do it. You just need to think about and get a little bit creative about how to work that muscle group and slowly start strengthening it from there. Anything else you have to say on that?
Yeah, if you just isolate that foot drop, so the tibialis anterior is the muscle, and if you slowly just start lifting up the foot repetitively, make it like your job to do that, and then consider the other muscles in the group, So if this is your foot, right, lifting it up and down, if you put a little bit of resistance band around it, pull in one direction and resist the band, your foot maybe won't be able to resist the band now, but with time, you want to strengthen it in that fashion. You want to progress it. You don't just want to get it to a point where you're able to do it. You want it to do it strongly so that when you're fatigued and you're walking like for long periods of time, you're not tripping over your foot. It begins to be a fall risk. And if that does sound like you and you tend to be falling or catching your foot a lot, there are orthotics that you can acquire to help you through this time of weakness until you get that strength back.
Yeah, there's also other types of adaptive equipment besides orthotics that I prescribe to patients regularly to kind of help with that, to help with you walk, stand, and do different things. So with that, it looks like we answered most of the questions that we have for right now. So just want to thank everyone who's out there. This was really fun. Thank you, Rachel. And until next time, have a great